I'm Herbert DuPont, Director of the Center for Infectious Diseases here at the School of Public Health, and on behalf of Roberta Ness, the Dean, and Eric Borwinkle, the Division Director, which the Center for Infectious Diseases is placed under, I welcome you to this extremely important and wonderful occasion of Jim Steele's 100th birthday. Since Jim Steele was appointed head of the veterinary division of the CDC in 1947, we've seen the emergence of a couple of specialties of medicine and public health. He was later appointed the first U.S. Assistant Surgeon General for Veterinary Affairs for the U.S. government. And Dr. Steele established two professional fields of public health and medicine. The first was the field of veterinary public health. Virtually everyone trained and working in the field of veterinary public health can trace their lineage directly, training-wise, to this giant in public health, James Steele. The second area was the study of transmissible agents, vectors of human disease that were acquired from animals that were either infected or colonized by pathogens. Dr. Steele can be credited to have led the concept of zoonoses, a concept that we teach public health and medical students everywhere. But when I was a medical student, that term didn't exist. But it does today, and we can thank Jim Steele and many of his trainees for creating that very important field of medicine and public health. These two contributions of Dr. Steele have led to the concept of OneHealth. Human health cannot be completely achieved without attention to the health of animals, and our speaker will address that today. In 1992, then Dean Palmer Beasley and I established this lecture to recognize the important contributions of Dr. Steele and to bring important scientists to Houston to meet with us, to educate us on areas of importance. The occasion of the first lecture was 1993, when Jim was a mere 80 years of age. We are now celebrating the life of Dr. Steele with the 21st annual lecture. Wouldn't you like that, to start something when you're 80 and see the 21st anniversary? Jim Steele is a mentor and a role model in many, many ways, not the least of which is his longevity. We are blessed by having Dr. Steele attend each of the lectures so far held, and now enthusiastically celebrate Dr. Steele's 100th birthday and the 21st James Steele lecture. And I'd like to now introduce Dean Roberta Ness.
So thank you, Dr. DuPont, and thanks to all of you for being here. We're just really pleased to see such a wonderful turnout for such an auspicious occasion. And I would like to just add my welcoming remarks to those of Dr. DuPont and say that it really is very special, very delightful to be here on this occasion of the 21st Annual Steele Lectureship, and of course on the occasion of Jim's 100th birthday. And Jim and I were just having this wonderful conversation out in the hallway where he reminded me that 101, which of course will be the year that he starts almost immediately now, is also the course number for most introductory courses, 101.
Yeah.
And so we agreed that now he's entering his second life. So Jim Steele in his new incarnation, the new life, the 101st year of Jim Steele. So very special. So as Dr. DuPont told you, Jim is known worldwide as the father of veterinary public health and the creator of the very notion of zoonoses. Bert told you much about his past when he retired from being the founder of the Veterinary Public Health Division of the CDC and the first U.S. Assistant Surgeon General for Veterinary Affairs, and then the Deputy Assistant Secretary for Health and Human Services, the rank of Admiral. He came here to the School of Public Health to become a professor of environmental health, and it was here that he initiated his very famous textbook, the CRC handbook series on zoonoses. And I would just say personally that when I look at Jim's life, his contributions put him in a category that can really only be defined as iconic. And I say that because if you really look at those outcomes that we all try to achieve, whether it be reduction in mortality, years of life saved, morbidity averted, even the enhancement of prosperity and welfare, Jim's contributions really exceed those of most other people in the world. And it is in admiration for this incredible legacy and with the delight of being one of the first of very many to wish him a happy 100th birthday that we initiate today's lecture. So let me just take a few minutes to introduce Dr. Lonnie King, who is the Dean of the Ohio State University of the College of Veterinary Medicine, who is today's speaker. Previously, Dr. King was the director of the Centers for Disease Control and Prevention, National Center for Zoonotic, Vector-Borne, and Enteric Diseases, and of course, it's very appropriate, therefore, that he be giving this very auspicious lecture. He served as the Dean of the Michigan State University's College of Veterinary Medicine from 1996 to 2006, and of course now is the Dean at Ohio State. As USDA's Animal and Plant Health Inspection Service at the USDA, Dr. King directed the development of the National Animal Health Monitoring System and served as both the country's chief veterinary officer and director for national veterinary and animal health programs. Dr. King also helped start the National Alliance for Food Safety, and he has authored more than 100 publications. He's a board-certified member of the American College of Veterinary Preventive Medicine, completed the Senior Executive Fellowship Program at Harvard University, and served as president of the Association of the American Veterinary Medical Colleges from 1999 to 2000. He's also served as vice chair for the National Commission on Veterinary Economic Issues. It's with great pleasure that we welcome him to this lecture entitled Seeing Around Corners, A Century of OneHealth. Dr. King.
Well, thank you very much, Dr. DuPont, Dean Ness, for your kind remarks. It's a special pleasure for me to be here and take part and be invited to this grand tradition of the lectureship honoring James H. Steele. I'm especially pleased not only because this is a special occasion of his 100th birthday, but because I'm such a fan of him personally. A mentee, a person who, like everybody in this room, who I've admired for many years, so it's a special privilege for me to be here. Dr. Steele once was quoted to say that it's great to be a public health worker because your life is longer than anybody else. I hope that's true to all of you in public health. That's the reason I switched over, actually. So, Jim, that's absolutely true. So if you consider the life expectancy of Jim's cohorts of 1913, right, the life expectancy was 50.3 years for males. So in Jim's traditional way, he just decided to double it. And I just kind of mark that up to a person who's just been an overachiever all of his life. So he just decided to live 100 years rather than 50.3. So that's how he is. It demonstrates this wonderful attribute that he has. So today, I want to talk about, I reflect a little bit on Jim's life. You can't give a lecture on a 100th birthday and not reflect a little bit on this gentleman's life. Discuss a little bit about OneHealth, maybe a lot about OneHealth. Define it, its increasing importance in our lives. Talk a little bit about the great convergence that's taking place that really is leading to a revitalization of OneHealth, the wicked problems that we have, and we'll define those, and a triple threat to health, a threat to human health, animal health, and environmental health at the same time, and Jim's unique and uncanny ability to see around corners, to see the future when no one else could, and then look at those challenges and opportunities that we have as we kind of peer around the corners standing at the year 2013. And then just kind of end up with Jim, what influenced him, how influential he was, talk about him as an edge walker, which is actually a new society, by the way, in 2013, who saw the future, and then take some time to celebrate this wonderful birthday. So let's go backwards to 1913. Woodrow Wilson was president. Henry Ford was had his first assembly line for his Model T. First household refrigerator was manufactured. The New York Times actually started in 1913. Its crossword puzzles. It had 32 clues. The life expectancy, as I said, for men was 50.3 years. The average salary for a year was $750. Our U.S. population was 93 million people, 1.65 billion people worldwide. That's changed somewhat. Good whiskey costs $3.50 a gallon. I don't know what bad whiskey cost. And vamping was highly popular back at that time. These are the cohorts of Jim Steele. Jesse Owens, who actually was an Ohio State person, by the way. Richard Nixon, Gerald Ford, Vivian Lee, Vince Lombardi, Red Skelton, and I'm not sure if Jimmy Hoffa is still around or not. We can't figure it out. But I think Jim Steele is the only one that's actually outlived his cohort. Interesting enough, it's also the 200th anniversary of the birth year of Dr. Jon Snow, an anesthesiologist, physician, who actually life changed during a cholera outbreak in London at the famous Broad Street pump, where he was credited with understanding and starting kind of the discipline of epidemiology and record keeping, as you will. It's also, by the way, the 150-year anniversary of the American Veterinary Medical Association. It's wonderful to have some past presidents of that association. Jim has been a member for 75 years. He's only been a member of half of it. I don't think there's probably anybody else around that's like that. So our congratulations. So this is Jim's century. And so just take a look at these remarkable happenings over the last century, right? A year after Jim was born, we understood who Typhoid Mary was and her importance to disease transmission. Right before that, The Jungle was published about food safety and the problems in meat plants and slaughter plants. Fleming's penicillin in 1929, the first Pap smear actually in 1928. Jim's DVM, you have to put that on the century, right, at Michigan State University in 1941, the start of the CDC in 1946, fluoridation of water in 1945, Salk vaccine, 1952, the double helix that won the Nobel Prize in 1953, and I think a really seminal book about early warning about what's happening in our environment with Silent Spring and Rachel Carson. And that really has come back to haunt us for sure. And then as we move through, we understood risks of tobacco to our health back in 1964. We're still trying to change people's behavior. We're doing better. Jim became Assistant Surgeon General, 1968, 2 years before the creation of the EPA. Smallpox being eradicated in 1979. And two diseases that really kind of changed the face of animal health and human health, certainly HIV/AIDS and what had started then, and a new disease popping up in England. And I happened to be there back at that time when I was with USDA and saw a bunch of cattle acting very strangely with neurological problems. What we have understood was bovine spongiform encephalopathy was caused by a prion that we had never actually understood before. Anthrax letters and bioterrorism in 2001. And waking up one morning to find out we had West Nile virus, we had SARS, and we had monkeypox in the United States at the same time, never before seen in the Western Hemisphere. Certainly a predictor of things to come. Human genome mapped in 2003, international health regulations, and rinderpest, an animal disease eradicated in 2011, only the second eradication of an organism from the face of the earth, and now things like synthetic bacteria. So this is a remarkable time. And part of this is the understanding that really starting in the 70s, and Jim, because he could see around corners, saw this coming. He was an early predictor. He saw this coming, was preparing CDC for it, for sure. And that's the emergence of a bunch of new infectious diseases and why those diseases emerged, right? And there were genetic, biological factors, environmental conditions from climate change, adaptation, ecological factors, social political factors, and unfortunately the intent to do harm. And so when you put all these together, they created what the Institute of Medicine was the perfect microbial storm. The time in history when all of these factors came together at the right time. And rather than creating a climatic condition like we see every 100 years in terms of hurricanes that are fabulous, these diseases are occurring constantly. And so the perfect microbial storm is swirling around because of these factors. And in the middle, out pops new emerging diseases in humans for sure, in animals, and in plants. And the whole idea then of the genesis of OneHealth, which started several centuries ago, came back into vogue because we see now what's happening. So just to take a look backwards at CDC's most significant global epidemics over the last 15 years, starting in 1993, about the time this lecture series started. And if we had more time, I'd give you a quiz. It's which of these are zoonotic, and the answer is they all are. So why is it that veterinary medicine that Jim saw so many decades earlier is now important to public health and human health? Well, this is what we call evidence-based, right? This is why our world is so interconnected and so changing, and why our mindset needs to change to a One Health focus. So this was an article that came out in Nature a few years ago by Kate Jones, and she was just looking at global trends of emerging infectious diseases starting in 1940, and she tracked them by decades. And you can see the increase in emerging infectious diseases. And 1980, the decade was, of course, AIDS, and new emerging infections came from people who had HIV/AIDS. The slide on the left actually looks at drug resistance, which are the white area of those bars, and she believed that those were new emerging infectious disease problems, and indeed they may be one of the real problems that we face in the next decade in public health. And in the right is really vector-borne diseases. Those are the white parts of those bars. But this demonstrated that indeed all of the factors in place for the perfect microbial storm are creating these increases of emerging infectious diseases, and they continue to do so. There's nothing on the horizon that suggests that this is going to change. As a matter of fact, it's likely to accelerate. So in veterinary medicine, we understand the concept of multi-host pathogens. When I was a veterinarian out on the farm, and I won't tell you when that was, when you went out on the farm and saw a disease, I always thought, well, what is happening, and is this actually transmitting across species? And about 80% of diseases we see in veterinary medicine are really multi-host pathogens. They cross species lines. But what has been kind of a new idea, I don't know why, but it is new to some people, that of the 1,461 human pathogens, right, clearly 60% of those are multi-host pathogens. They cross species lines. So the ecological journalists are the ones that win, right? They are the winners. And in the world of microbiology, right, this is Club Med for microbes. They've never been happier. They move around the world, luxuriate in any places that they can. They cross species lines. They move around the world faster than the incubation period of the animals and foods that they're a part of. And so it is a phenomenal period. They've always been ahead, I think, in terms of adaptation, but we've never given them the opportunity like we're giving them today. So it's a triple threat to health. And this is what we talked about at CDC. So it's a threat to human health, animal health, and certainly to environmental health. And the time has come that we can't look at these separately. That just doesn't work anymore. It's the integration, interconnectivity of these three domains that now have to be worked on together. The essence of One Health. What James Steele preached and saw and looked around the corner decades ago, right, has been a prediction that has absolutely come true. So OneHealth is not a new concept. It actually was probably more popular back in the 19th century, but as medicine split out and became more specialized, right, I think animal health and human health kind of separated. And so our contemporary problems now, which we call wicked problems, really require that to come back together. That's what Jim has preached. That's what he's talked about. And it is starting, I think, to happen. And so our world is just exquisitely and uniquely interconnected, more so than we've ever seen. It's unprecedented as we move forward. The acceleration of the human-animal interface is creating new opportunities and new conditions and new challenges that we've never seen before. This is a global phenomenon. It's certainly not just in the U.S. So it's going to take a very holistic, collaborative, multidisciplinary approach that James Steele helped move ahead in the last 50 years of his career. And it's an emphasis on preventive medicine, right? Certainly in public health, we understand that. We can't spend $1.5 trillion a year on health care without starting to turn back and understand we need to go upstream, we need to attack problems at their origin, and they aren't humans in hospitals. The OneHealth, the collaborative effort of multiple disciplines working locally, nationally, and globally to attain the optimal health of humans, animals, and our environment. That's the call. And if there's ever a time to start doing this, it was 2 decades ago, but it is now, right? We cannot do these things by ourselves any longer. So just to show my age, when I was a kid, I had a kaleidoscope. You know, that was one of those things where you changed the chambers, and every time you did that, the glass changed, and you had a new view of the world. It's kind of what's happening today in OneHealth, right? It's just a little tweak here and there, and the kaleidoscope changes. So let's kind of take a look at the kaleidoscope through the views of what's happening in human health and people. Well, we know what's happening, right? The population on the face of the earth is increasing to over 7 billion people. So take a look at these trends from 1950 and looking at a prediction back into the middle of this century. We may have 9 billion people on the face of the earth, friend. But the red bars, right, the red part of the bars are the growth in the developing world. 90%, over 90% of the growth of human populations are in the developing world. The very countries we really worry about in terms of their infrastructure and human health and animal health, their surveillance ability, the ability to detect a problem quickly and take care of it in this interconnected world where we can spread things in less than 24 hours. So that's where we are. The blue lines are population growth in the developed world. And this is where the major populations are. This is 1 billion people on the face of the earth are in peri-urban settings, slums, right? That is the fastest growing population on the face of the earth. And if you don't think this is a picture of OneHealth, look again. Think about the environmental conditions here. And I can tell you that there's all kinds of animals not only in this population, but right on the edge of it, as we're redefining agriculture and people working as agriculture is moving toward these large cities, right? And this interface is changing rather dramatically. This is the greatest migration and shift of people in the history of the earth. No other time in history have people been moving and shifting like they are today. And the greatest migration are to cities. So at Jim's time, when he was born and spent his early years in Chicago, 13% of this population was urban. A couple years ago, we passed where most 50% now are urban, and that's increasing at a very rapid rate. And what it is pushing is the intermingling of these domains of human, animal, and environmental conditions and problems that we need to pay attention to. And the peri-urban areas are really, as you know, in the cities of the developing world. It's a phenomenon that we are continue to see, and it creates brand new niches for vectors, for microbes, and the conditions as we move ahead. This is a revolution in terms of motion and movement. We've never seen this before. Think about 1.5 million people moving into cities every week. 1.5 million people moving into urban settings weekly for economic reasons in part, right? Changes of lifestyle. And think about what that is creating. There's over 50,000 airports. I visited 3 of them last night trying to get here. 20 million miles of roads, right? 700,000 miles of railroad track. And a typical manufacturing company relies on more than 35 different contract manufacturers worldwide for their products. You don't think we're interconnected? 300,000 facilities in 150 countries send 24 million shipments to the United States through 300 ports of entry, right? And FDA says that they actually inspect 10%. It's actually considerably less. So this world is not only growing and interconnected, it's porous. So it's part of the transformation. Traveling. Over last year, there was over 2 billion people traveling in airplanes, right? And over 1 billion are now traveling internationally every year. So our world is one simple global community. We are interconnected in ways that we've never seen before. This is the super vector, right? It's not just the mosquito, right? So I just came back from New Zealand, and I was on one of these things, jam-packed full, right? Sharing air, sharing who knows what. But this is the super vector as we move worldwide. Right now, there's $17.8 trillion of global trade. Trillion dollars of global trade. And about 25% of that are agricultural goods. They're animals, they're products, they're moving around the world. And travelers are doing the same thing, and these are just interactive biological units, if you think about it. Right? They're just a transfer mechanism. And what we find out is what? New emerging health problems. So the trade agreements are about the deal. It's about $17.8 trillion moving to the next $1 trillion level. And what's been left out of this is really health. So the World Trade Organization doesn't have a health committee. Right? This is about the deal. And public health, whether it's CDC or international groups, are struggling trying to keep up with this mammoth increase in trade, and we really haven't done it. The biggest change has been the international health regulations, right, that have really been put in place to keep up with this, but we just haven't had money really to put them in place and implement them around the world. So Movements of the World's Biota is creating new interfaces that we've never seen before. What a great time to be alive, and not only your 100th birthday, but isn't this a phenomenal time if you're an epidemiologist or believe in microbiology? Well, what's happened in the world of animals? Well, last year, over 30 billion animals were produced worldwide to help feed 7 billion people on the face of the earth. And projections by the Food and Agriculture Organization are pretty much in line to suggest in the next decade or so that we're going to have to increase food production and animal production by 50%. So we're just going to shovel in 15 billion more animals into the system. It is the remarkable convergence and mixing bowl of the 21st century, right? That is the foundation of OneHealth. It is pretty remarkable. So Livestock 2020, and it's probably 2025 because of the economic problems, is about the increase in demand as people move from kind of abject poverty into a level of, we call middle class, and that's, quote, middle class. So, but it is a way when people add wealth, on a relative term, right, that they westernize for good or for bad. And that westernization actually includes, especially, eating foods of animal protein. Right? And so as we add 1 to 2 billion people into new classes of wealth, this is what's happening in agriculture. This is not like the Green Revolution that was supply-driven. This is demand-driven. This is a demand. So where do you think agriculture is going to happen? It's not going to be in the middle of Iowa. It's going to be in the developing world. So think what's happening to our environment. Think what's happening in exchanges of disease. Think what's happening in this $18 trillion of trade as our world becomes more interconnected, and the sustainability of that. This is the world meat consumption from 1983 projected to 2020. This is in million metric tons, right? The red line is the world consumption that is, we know, and is projected into the future, right? And the blue line is world meat consumption in the developed world. So 200 metric tons is a lot of Big Macs, right? So there's a lot of animals now that are in part of our world and part of our communities as we move ahead. And so this has created several things. One is food security. Jim talked about this 2 decades ago. I know it's on his mind because I've read his papers and I've talked to him. Food security is a huge issue. And it's a huge issue for the public's health and well-being. So we're adding 1 billion people per week, right, as part of our population for the next 40 years. So that'll get us to 9 billion, right? We now need to produce more food over the next 40 years than we did during the last 500. How's that going to get done? What are the consequences? How does that impact health as we move future? And these are real challenges as we move into the 2020. Both urban and rural insecurities of food, new zoonotic diseases, and really OneHealth. So for me, I've never really seen a time quite like this. And 2 things happen, right? Well, this is one of them. The article came out of The Economist. So one of the issues is, and I think the term is overnutrition. That's a nice term. It's an obesity problem, not only in this country, but other sectors of the world. It's about food for sure, but it's also about people's habits, right? How they consume food. And it is a huge problem. But here's the other problem, right? It's people like this little girl whose life and her family's life depends on a couple of lambs. Right? And this is the importance to her and to her family. Right? And 70% of the rural poor, 30% of the urban poor depend on livestock. It's part of how they go through life. And there was a study just done by the International Livestock Institute in Nairobi that assessed 56 zoonotic diseases globally and found they're responsible for 2.5 billion cases of human illness and 2.7 million deaths a year. Now, I don't care what school of public health you're in, that's an epidemic. So why don't we do something about these neglected problems, right? And this is massive underreporting, huge burdens of illness on the bottom 1 billion, the people that can't get out of poverty, and the people whose lives are connected to their animals every day. They live on less than $2 a day. So of these top zoonoses, right, most of them can be intervened through their animals and through agriculture. So here's just an idea of where these outbreaks are occurring and zoonoses take place for the 1 billion poor livestock keepers that we see worldwide. Right? And you can see belts through India, Africa for sure, and Southeast Asia. So it's 800 million to 1 billion poor livestock keepers at risk. And controlling and investing in animal health, we know benefits human health and well-being, but it's not being done. It's too poor. We can't get it delivered. And we somehow have to close this gap between human and animal health, between veterinarians and physicians, and add our colleagues in ecology and environment in. Right? You can't let 1 billion people on the face of the earth really suffer like this through zoonoses. So this is indeed OneHealth, the new paradigm, if you will, holistic, collaborative, strategic. So I've been to a number of countries, and one of the things that I find fairly consistent, especially in the developing world, is this crux of the problem that for all of these zoonoses, right, 2.5 billion cases a year, the risk to human health is the most important, but the way to control that is through the animals. James Steele saw that a long time ago. We see that today. It's now time to actually do these things and merge these together. So it was Jim that said, good public health and good animal health provide good economic health. Absolutely right. And good economic health means the alleviation of poverty by actually improving animal health. Can be done, it is being done, and I think it needs to be done more. The Gates Foundation a couple weeks ago just put out for the first time, right, new proposals on OneHealth. And they said, basically, just like the World Health Organization, if we improve animal health, we understand now that that can improve human health. The children, the women that are taking care of these animals in zoonoses, and increased production increases nutrition and increases their ability to move forward. Ecosystems were not doing very well either, right? We have substantively and probably permanently changed 50% of the face of the earth, and not for the better. These are the things that we do. 1.1 billion people lack access to clean water. 2.6 billion people lack access to adequate sanitation at this time. We're not sure, with all these climate variations, is this a long-term trend for global warming? Certainly seems like it to me, but all of the conditions that will swirl around OneHealth with that. So it's time to look around the corners, right? And only a few people can do this well. But Jim Steele can do it better than anybody, right? And I kind of think of OneHealth as kind of the dynamics of looking at these OneHealth domains as the same as Newton's third law of motion, that said, in essence, for every action, there's an equal and opposite reaction. So you push on one of those circles, and it pops out on the other side. And so what we have now is really Newton's law in public health, where you cannot look at these circles separately. You cannot poke on one side in environmental health, and it comes out on animal health and human health as a negative. It's time to look at these together. And these problems are called wicked problems. It's actually a business term that talks about problems that are complex, unprecedented, that are enigmatic. They have no yes and no answers. So there's no binary solutions. They are unexpected and have unexpected consequences. They're symptomatics of other problems. But most importantly, they're unique because past experiences are not helpful in solving them. Past experiences are not helpful in solving them. So this is why the whole mindset of looking at animal and human and environmental health as a single condition or a single entity makes so much difference. And we know that health is shaped by 5 factors, right? Genetics, socioeconomic, environmental, behavior choices, and medical care. And it's this wonderful medical complex, by the way, which I congratulate the University of Texas and this Houston group. It only is responsible for about 25% of determining our health. So it's time to start thinking about the other parts of OneHealth, integrating these factors as we move ahead. And OneHealth is much broader than zoonoses. But we focused on zoonoses a lot in infectious diseases. Genetics, socioeconomic, environmental, and human choices are just as important, if not more so. So OneHealth continues to be important. I think it's growing importance. Our interconnected world, the complex, difficult, wicked problems that we have, that old solutions don't work any longer, the great convergence of the mixing bowl of the 21st century, the microbial swarms, right? We think we probably know less than 1% of the total microbial population that's out there. And think about the new interfaces and what we're going to find very quickly. A world in rapid motion that geographers called a collapsed space. It's all together, right? Food security, food safety, water issues are growing more and more importance in our lives, climatic conditions, the shift to ecology. And the thing that OneHealth really does is to push upstream, is to start looking at the foundation, if you will, the genesis of the problems, attacking, putting interventions there, not waiting until somebody gets ill. And that shift, of course, is in the sweet spot of public health, is exactly what OneHealth is about. So just thinking back about Jim and kind of reading his history and talking to them, you know, and I have to kind of see if Jim agrees with this, but there was a gentleman at CDC named Joseph Mountain who said to Jim, "What are you veterinarians going to do for public health now that the war is over?" Well, this was back in the Second World War, and Jim had already started, and the role of veterinarians in public health was in sanitation and food safety. And, you know, and so here's this question that Joseph Mountain asked Jim Steele. And I think all of us are kind of influenced by our circumstances and events in the past. Jim, time at Michigan State University, actually interested in forestry, then in veterinary medicine and public health. He had OneHealth down a long, long time ago, back in the 40s, right? Shifting to veterinary medicine, an outbreak when I visited with him at East Lansing, Michigan, he pointed to a laboratory where a brucellosis outbreak actually in the lab caused the death of some students and lab workers. The genesis of perhaps his interest in zoonoses, right? His time at public health at Harvard, when the dean of public health said to him, as the only veterinarian in a group of physicians, why don't you just fly under one flag? I think that was the start for public health, not what Jim knew, but maybe for the dean of the medical school. So, but I think this conversation is really seminal. So think of a time in your life that really kind of changed you. So you should never ask a question to an overachieving visionary who has the knack of seeing around corners, a question like that, because he's going to spend his career to answer it. And he did. And answer it, he did. I think the rest is actually history. So Jim spent his professional life answering these questions, helping to orchestrate a new future, if you will, for veterinary medicine, for public health, and to revitalize OneHealth. So I think this was a very important question. I think today, at Jim's 100th birthday, which is tomorrow, right? He still asks that question. He wakes up in the morning thinking, what in the world could we do for veterinarians after the war? Well, he's been through 2 world wars, 4 global pandemics, but he continues to move forward. So I think that was really a seminal event. And so this is veterinary medicine today. Jim saw it. He saw it around the corner, right? It wasn't just about animal health. He knew about that. But now it's ecosystems, it's public health, it's global food systems, it's biomedical and health research. This is the rich, amazing future for veterinary medicine as a part of human health. And this is, I think, a wonderful vision that Jim had, and our profession is now gathering around and doing just that. So Jim Steele has really lengthened his shadow. His influences that we've talked about, having a new veterinary corps for the U.S. Public Health Service, his work with Alex Langmuir, with EIS program, and he was an honorary member. Partnerships with agriculture, as Jim saw, looking around the corner, how agriculture and public health needed to come together. And he did that with USDA, part of AVMA. And we talked about, or heard about from Dr. DuPont, how he actually started specialties, right? And then he went global. Whether he's worked with PAHO and OIE, he saw around the corner again this big picture of what needed to be done. He talked about his work as in zoonoses, but the father of veterinary public health. And there's a great short history that's coming up, and my colleagues, Dr. Cowan Courier and Jim himself, I think, when we look forward when that comes out. So Jim is also what we call an edge walker. By the way, there's a new society of edge walkers. If you kind of don't know what to do with yourself, these are people who successfully walk between the worlds of today and tomorrow. They have a foot in different disciplines, and they have the ability to bring it together. No one has done that better than Jim Steele. They have a knack for knowing the future. Their perspective is not just local, it's global. An intense focus on purpose, right? And a gift of seeing what others cannot. The possibilities and trends of seeing around corners and committing themselves for something greater than themselves. I hope everybody in the room agrees with that and are really trying to do that in various stages of your career. So this is the person that we honor. This is why I wanted to come down and talk and give this lecture. And One Man, One Medicine, One Health, the Jim Steele story. And my colleague, Dr. Craig Carter, is here as the biographer. It's a wonderful read. All of you should read it. If you don't, you still have the rest of the day to get it finished. So let's kind of, as we close here, let's kind of take a look at what's happening in the future of public health. So if you're Jim Steele, you're looking around the corner again, right? And so here's what I see coming, and I think Jim Steele sees coming as well, right? Antimicrobial resistance. I think this is our next big problem in public health over the next decade. It's huge. I think we don't know how big it is until we actually offer some solutions other than antimicrobials, which is happening. Food security. Wars will be fought over food. Famines will still occur. A lot of that is about the ability not only to produce food for 1 billion people joining the face of the earth every week, but to distribute it. Water. insecurity, contamination, shortages. In the United States, there's 53,000 separate water utility systems. Who inspects those? I can tell you that half of them have real problems already. And global health is a form of diplomacy. What a wonderful possibility for us in this country to think of exporting our knowledge and health to really help the global communities. New emphasis on public-private partnerships. We cannot do this by ourselves anymore. The huge issue right now, I think, facing our country and many others is the separation of what governments would like to do or should do versus what they can do. And that separation is getting greater and greater. And the ability then to add private partnerships into that, I think, is going to be part of our world. And a worry that we have, as we increase life expectancy, do we increase health expectancy? So are we going to be a healthier generation that just lives longer, or an unhealthy generation that lives longer? Food and health synergy that Jim brought to our attention is now. Food's not just going to be a sustenance. It's going to be the ability to deliver food, deliver medicine, to have new properties and to improve our immunity, to add to our productivity. And we see great possibilities in food in whole new ways of bioengineering. A new era of advanced analytics that really haven't kind of taken place in public health yet. We have the ability to do this. It's just starting to happen, and it will change our idea of evidence-based public health. The shift to prevention because of personalized medicine, where people have the responsibility and accountability to do more. That we're going to define health and disease more and more about our microbial populations. Wonderful new research on microbes, that we have 10 times more cells in our body and on our skin than we do have human cells, and how that is actually defining, right? The signaling, the dynamics of these populations of microbes is defining health versus disease. And we're just really learning about that, and we're learning about how to make intervention strategies that make that really worthwhile. And we'll continue to have increased outbreaks of these pathogens because where we are. We need to find the benefits of the digital age. It hasn't really, I think, optimized itself in human health and in public health. But it can with all of our cell phones and our ability then to do that. Synthetic biology, it's going to recreate vaccines. Spasms of extinction. So we're losing species at 1,000 times greater than any other time since the dinosaurs disappeared. It's our responsibility. We wake up in the morning, that is part of our responsibility. Right? And what's going to happen as those species die away in terms of any kind of effect that we had to kind of take care of emerging infectious diseases, now they go directly into people. Community health teams, Jim saw that. That's coming. Acceleration of the human-animal interface, the social responsibility, doing well by doing good. So what would public health, global health be like today without Bill Gates Foundation, without all of these entrepreneurs and people and NGOs who are investing in the health of others? It's been a game changer as we move away. And adopting OneHealth. So we're going to invest in public health, research, it's past time. There's community-based preventive medicine. We're going to alleviate poverty in the bottom 1 billion by improving animal health. Extreme weather conditions will continue to change. And one of the big shifts is already taking place, and that is from major agribusinesses who are now going to be in the business of agroceuticals. The fusion of medicines, interventions in food into people's health, and then the shift to a OneHealth paradigm. So that's us. That's seeing around the corners as we move into the future. So I think this is Jim, right? If I think about James Steele, it's about growing bigger minds to solve bigger problems. Everybody in this room should be thinking about growing a bigger mind because our problems are immense, they're wicked, and they need our attention, right? Our horizon has never been richer, nor the possibilities more promising than what they are today. We need to be responsive, responsible, and relevant to OneHealth. And in any organization, whether it's public health or whether it's this health science facility or where you work, we must reimagine the deepest sense of who we are, what we do, where to focus our resources, our time, and attention. and that is changing because the world is changing so quickly. It's the paradigm. So there have been extraordinary advances in public health over Jim's century. A number of heroes, certainly heroines, great scientists, and committed public health workers worldwide. But there are only a handful of people who have the special gift, the special skill to literally see around corners. They're always a step ahead, envisioning and understanding a future that's kind of foreign to us mortals. They position organizations, professions, they influence beyond their boundaries, and they cast enormous shadows as they help create a different future. Jim Steele is such a person, an edge-walking visionary who saw the critical need for OneHealth and helped champion it throughout his career. So always seeing around the corners, Jim said that he looked forward to his 107th birthday, and I do too, by the way, and that will be in the year 2020, when he can finally say, hindsight being 2020, yep, we got it right. Well, let me tell you, you don't have to wait to 2020. Jim Steele got it right. He got it right early on. He's got it right today. And it's wonderful to be able to follow him, what he's done as we move into the future. We are indebted for his vision. We're indebted because he strengthened our actions, and we're better off because of his commitment to improving human health, animal health, and environmental health. I salute Jim Steele on this very special occasion. And one other thing. Oh, did I tell you he had good taste? I can't go through today without acknowledging Brigitte and her wonderful contributions, not only to Jim's life. She's a wonderful person. You know, he saw around the corner there for a young woman that he saw many years ago that has changed his life for the better, and all of us. Brigitte, thank you very much. So, Jim, that's my conclusion. Ladies and gentlemen, thank you for your attention. And, Jim, happy 100th birthday.
You want to take the question?
Sure.
Thank you, Dr. King. That was beautiful. And what a fitting talk for Jim's 100th birthday. Dr. Steele, I would like for you to have the first comment. Are you up for that? A comment or question?
I would like to comment and say this is a wonderful start for the new century.
So that's an example, I think, of seeing around corners. Right.
The problem that existed when drinkers at Harvard came, he brought to his attention, I had a personal problem. My first wife had bronchial tuberculosis, which disturbed me very much. But I still finished the curriculum, and came April, I was looking for an opportunity where I could act as an epidemiologist with my veterinary public health training. Nothing like that came to be. I had some other tragedies occur in between, but finally I ended up going to the Public Health Service office in Chicago and told them I was a beneficiary of your largesse in sending me to Harvard to get graduate training. Nobody had previously carried DVM to an advanced course in public health. That was breaking the frontier. But the bigger thing was that the office in Chicago said, we need people like you. And a man by the name of Henry Howley, who came from Texas and was an officer in the Public Health Service, said, well, let's call Washington and see how we can fit you in. And this was the beginning of a higher defense of veterinarians in public health. I always had good medical officers supporting the concept that veterinary medicine was a branch of human medicine, and a number of medical writers, namely J. Hunter of England of the late 18th century, early 19th, uses a quote that veterinary medicine is the comprehensive coverage of nature, of everything outside of the human body. We deal with the environment, we deal with the effect of animals. But going through the years as I arose in the public health service, you always have to have good opportunities. And good opportunities came in that first few months of the public health. I was in Washington. First, a call from Panama, a new disease. We got a guy that maybe he should go down and look at it. I was a guy, and I had Carl Havel, a very effective physician at NIH, come along with me to see what they were talking about in humans. We arrived there, and we were told that there was a disease of horses that were affecting the children. And, well, I just couldn't get that. And we got to the community, we saw immediately it was encephalitis in the horses. And after the preliminary examination, sample, so forth, we went to the hospital. And what did we see? We saw people with the arm dropping just down like that. And there was, Carl said, my God, this is polio. And I had said the other was encephalitis. What this was a mistrust of the medical people of Panama, believing that the veterinarian did not know. My concept from that day on was they convinced the physicians that we as veterinarians understood our responsibility. And the greatest challenge came up some years later, in fact only a year later, with the outbreak of foot and mouth disease in Mexico. This one was bounced around the public health service, and one day Mountain said to me, Steele, you know anything about this disease? And I said, well, what I learned at Michigan State. He said, why don't you go down and take a look at it? And the problem was that the medical people were saying this was attacking the humans. And I went with that trepidation. Is this going to be a revolutionary change in the behavior of the aftosa virus? I get to Mexico and speak to the old people of the VAI, and lo and behold, what they have identified is two different diseases. One, a virus disease that causes small particles in different animals and humans. But aftosa or foot and mouth did not. I came back and reported this to Mountain. Mountain reported it to Williams, one of the highest. And then Dr. Williams says, Dr. Perrin should hear this. And Dr. Perrin had me in his office, and I explained to him the difference in these two diseases. From that day on, I had complete medical support at the highest level of the public health service, even though for years after I was attacked by many groups. One of the groups that really went after me was the chicken industry, when we tried to make sure of getting the chicken industry out under USDA inspection. All these things, you have to be prepared to handle situations that you never dreamed about. And I pay a high tribute to my medical friends, and today I recognize all veterinarians as good public health people. And finally, and one of the nicest expressions that came to my attention a few years ago was when the director of the Pan American Health Organization, on an occasion they were recognizing me, she said, "Steele, do you know that you get more support from the MD community of South America than you get from your veterinarians?" And I said, "How come?" And she said, "Well, the medical profession is at a higher level in the government, and they have a direct influence in saying that one medicine involves all veterinarians, and their training should include public health." Thank you all.
Wow.
You may want to go on and grab a second.
Dr. Steele, you can't see it, but everyone in the room stood up and applauded to you. And the audience just heard the 20-second Steele lecture. Congratulations. I think we'll close at this point, and with Dr. Dieter Grossklaus. Is Dr. Grossklaus here?
Great.
Okay, come on up here and say something, and then I will make a presentation, and we'll close for the day. So, Dr. King, don't go far away.
Yeah.
My dear friend, Jim, dear Brigitte, distinguished guests. First of all, let me say that is a great honor and pleasure for me and my wife to have the opportunity during such a special birthday banquet or lecture afternoon to recognize and certify the international merits of our person of honor today. I did this already 5 years ago on the occasion of the 95th birthday. I have come to Houston this time not in an official function, as in former times the president of the Federal Health Office in Germany, but this time as a friend, a personal friend, to congratulate you, dear Jim, on your 100th birthday. 20 years ago, you taught us, it was already mentioned, life begins at 80. According to your statement, Jim, I understand you are in the right age now. When praising your professional and human work, I do this also on behalf of all colleagues and friends in the field of veterinary public health worldwide, but especially of the colleagues and friends in Germany and in Europe. They all mentally take part in this moment of such an excellent birthday celebration. I have met you, dear Jim, for the first time at the World Veterinary Congress 1971 in Mexico City. Since that time, we have developed very close cooperations in the large field of veterinary public health. Your position as former Assistant Surgeon General facilitated these contacts very much. From my personal viewpoint, your merits are based on your consular position in the Robert von Ostertag Institute of the Federal Health Office in Berlin, which you took over in 1972. In your function, you promoted very convincingly the research work of this Federal Health Institute, which had been designated in 1975 as WHO Collaborating Center for Training and Research in Food Hygiene and Zoonosis. At the same time, you were appointed as a member of the Zoonosis Expert Committee of the World Health Organization in Geneva, and you acted very successfully as consultant in various fields of the Division of Communicable Diseases and Food Safety of this agency. During those years, the important work of the Veterinary Public Health Unit of the WHO was decisively influenced and promoted by your extraordinary, extensive knowledge and ideas in this field. The same applies for your supporting activities in the food safety program of the WHO. In addition, you have been well known as an international scientist within the World Veterinary Association, coupled with a viable knowledge in the entire field of veterinary public health. In most world congresses held on veterinary science, you were nominated to act as keynote speaker and chairperson. In such a way, you supported very much the World Congress Foodborne Infections and Intoxications held and founded in Berlin 1980. Because of your admirable and simply wonderful rhetorical qualities, you represented your home country, the United States of America, in a very specific and brilliant way. In 1975, you were nominated as an honorary member of the World Veterinary Association. Without any interruption, you have supported in the past symposia, roundtable conferences, world congresses, and other activities of the World Association of Veterinary Food Hygienists with your advice, with lectures and with your participation. In 1985, you were nominated as a member of the advisory board of the Federal Health Office in Berlin, in Germany. You supported the president of this office with more than 3,000 workers, mainly in questions of national and international health care and public health, considering especially veterinary public health experience in zoonosis control, in food hygiene and foodborne disease control. You acted very successfully in building bridges between the US Surgeon General, the US Public Health Service, the Center of Disease Control in Atlanta, and the NIHs in Washington on the one hand, and the 6 institutes of the Federal Health Office in Germany, including the famous Robert Koch Institute, on the other hand. In 1992, you were awarded for all your activities with a Medal of Merit during the inauguration ceremony of the newly constructed Robert von Ostertag Institute of the Federal Health Office, the only central federal veterinary public health institute in Germany and Europe. Your remarkable contributions in the field of food irradiation as one important way to eliminate agents in food of animal origin initiated heated discussions in Germany and among the European community. Beyond that, you developed close contacts to scientists, teachers, and students, not only in Germany, but also in various member states of the EU and Eastern European countries. There you acted always as a kind of ambassador to unify countries and people to overcome ideologies by means of accomplishments on a very high level and information on the basis of liberty and democracy. There is no other person behind you who were better suited to do so as well-known and recognized scientist and character, an outstanding example with respect to bringing people together and to preparing our veterinary students for their professional future with enthusiasm and an up-to-date curriculum. To emphasize is your remarkable capability describing convincingly the importance of veterinary medicine for the development of public health, to better lives of both animals and people, which is combined with the highest level of professional accomplishments in this field. Your monographs and numerous publications, in particular in the field of zoonosis, proved to be a highly valuable and important source of information and knowledge both for scientists and students alike. You were able to establish a network of contacts and friendly relations with most of the colleagues of veterinary medicine worldwide and in our region. This proved to be very valuable for the city of Berlin and its Faculty of Veterinary Medicine at the Free University. After the unification of Germany, dear Jim, in 1889, you were the first lecturer from the United States to speak at the Humboldt University, the former University of East Berlin. Indeed, Professor Dr. James Steele, that means Mr. Veterinary Public Health, as you were called by your students, is a recognized leader in the field worldwide. Colleagues and friends all over the world congratulate on your 100th birthday and thank you very much for your efforts to fight against zoonoses and to promote in such a convincingly way the role of veterinarians in the field of public health and comparative medicine during your 70 years of professional career. We are pleased about the fact, recognizing you, dear Jim, in an additional celebration next July in Chicago, your birthplace, by the AFMA. We all would like to wish you and your charming wife, Brigitte, all the best for the near future, in satisfaction and in happiness. God bless you.
I'd like to have Dr. King come back and receive formal recognition for his beautiful James H. Steele lecture. And then we will close the meeting. Dr. King, here is a recognition of this wonderful lecture that you gave. Thank you so much and congratulations. That concludes the ceremonies today. Thank you very much.